Sleep, a healing remedy, or a double-edged sword? We all know that sleep plays an essential role in restoring and recharging the body. When we get enough quality sleep at the right times, the brain clears out neurotoxic waste, the immune system strengthens, and internal organs get the rest they need to function better the next day. While the dangers of sleep deprivation have been widely discussed, a more overlooked question remains. Can too much sleep actually harm your health, even increasing your risk of stroke? Recent studies have caught the medical community's attention, revealing a clear connection between prolonged sleep and a higher rate of stroke, especially among middle-aged and older adults. Ask yourself this: do you often sleep in on weekends? Have you ever taken a 2 to 3 hour nap and still felt groggy, heavy-headed, or mentally foggy? If this happens frequently, your body may be trying to warn you. Many people assume that sleeping more is a way to catch up on missed sleep during the week. But in reality, regularly sleeping more than 9 to 10 hours a day, particularly during the daytime, can disrupt your circadian rhythm, throw off your heart's rhythm, raise your blood pressure, and reduce the elasticity of your blood vessels. All of these are key risk factors for stroke. Large-scale studies have shown that individuals who sleep more than 9 hours per night have a 23% to 85% higher risk of stroke compared to those who sleep 7 to 8 hours. In this article, we'll explore the biological mechanisms behind this phenomenon. Why can oversleeping disrupt blood circulation to the brain? Why might chronic sleepiness not just be fatigue, but a hidden sign of cardiovascular or neurological issues? Most importantly, we'll look at expert insights from neurologists and cardiologists. How do they interpret the latest research? Who is most at risk? And how can we establish a healthy sleep routine that allows the body to recover without causing harm? If you or someone you love sleeps excessively, yet still feels tired, don't ignore what your body may be trying to say. Because by the time a stroke strikes, it's often too late to turn back. What does the research say? The sobering statistics. Let's start by looking directly at the scientific evidence. A large-scale cohort study published in reputable medical journals followed tens of thousands of adults for many years. The results have undeniably caught the attention of the medical community and the public.
Underlying cardiovascular disease. Mechanism: heart problems such as heart failure, arrhythmias, or undiagnosed coronary artery disease can reduce the heart's efficiency in pumping blood. When the brain doesn't receive enough blood and oxygen, the body may respond with fatigue and an increased need for rest and sleep. Link to sleep. Fatigue due to heart disease is a common reason for patients to sleep more. These very heart conditions are leading risk factors for ischemic stroke caused by a blood clot traveling from the heart to the brain. Sleep-disordered breathing, obstructive sleep apnea, OSA. Mechanism: OSA is a condition where the airway repeatedly becomes blocked during sleep, causing short pauses in breathing. This leads to drops in blood oxygen levels, increased blood pressure, and stress on the cardiovascular system. OSA is an independent and potent risk factor for stroke. Link to sleep. Although individuals with OSA experience fragmented and poor quality sleep, they often feel very sleepy during the day and may have a longer total sleep time, including non-restorative naps, in an attempt to compensate for energy deficits. Depression and other psychological conditions. Mechanism: depression not only affects mood, but also causes biological changes in the body, including increased inflammatory markers and effects on vascular function. Link to sleep. One of the common symptoms of depression is sleep disturbance. While some suffer from insomnia, a significant proportion experience hypersomnia, excessive sleepiness as a way the body copes with emotional and physical exhaustion. Sedentary lifestyle and poor physical condition. Mechanism. Lack of physical activity increases the risk of obesity, high blood pressure, diabetes, and other components of metabolic syndrome. Link to sleep. People who are sedentary often have lower energy levels and may feel the need to sleep more. This vicious cycle, inactivity leading to fatigue, fatigue leading to more sleep and even less activity, can escalate health risks. Oversleeping, an SOS signal from your body. From the analysis above, it's clear that instead of viewing excessive sleep as a mere bad habit, we should perceive it as a potential SOS signal that the body is trying to send that something isn't right internally, demanding attention and timely intervention. Ignoring the signal or simply trying to cut back on sleep time without addressing the root cause can lead to serious consequences. Like turning off a smoke alarm without putting out the fire, you are allowing the risk to smolder and potentially erupt at any moment. Listening to your body. What to do if you oversleep.
If you find yourself regularly sleeping more than 9 hours a night, or taking unusually long naps and still feeling tired and lethargic upon waking, don't be complacent. Here are the steps you should take. Reevaluate your overall lifestyle. Diet. Are you consuming too many processed foods, sugary items, and unhealthy fats? Increase your intake of vegetables, fruits, whole grains, lean protein, and healthy fats. Physical activity. Are you getting enough exercise? Aim for at least 150 minutes of moderate intensity activity per week. Stress. What is your stress level like? Find effective stress management techniques, such as meditation, yoga, or spending time on hobbies. Sleep quality. Is your sleep environment conducive to good sleep? Quiet, dark, cool? Do you have a regular sleep-wake schedule? Regular health checkups. Don't wait for symptoms. This is the most crucial step. Share your unusual sleep habits with your doctor, along with any other symptoms like persistent fatigue, shortness of breath on exertion, headaches, dizziness, unexplained weight changes, loud snoring, or witnessed apneas reported by a bed partner. Your doctor can order the necessary tests to screen for stroke risk factors: blood pressure measurement, blood tests, blood sugar, cholesterol levels, liver and kidney function, and inflammatory markers. In some cases, more specialized investigations like an echocardiogram, heart ultrasound, or a sleep study, polysomnography to diagnose OSA, may be needed. Treat underlying conditions, if any. If diagnosed with conditions like hypertension, diabetes, dyslipidemia, heart disease, OSA, or depression, strict adherence to your doctor's treatment plan is paramount. Effectively managing these conditions will not only improve your quality of life, but also significantly reduce your stroke risk. Optimize sleep hygiene. Maintain a regular sleep schedule, even on weekends. Create an ideal sleep environment. Avoid stimulants such as caffeine, nicotine, and alcohol close to bedtime. Limit exposure to blue light from electronic devices before bed. Relax before bed. Read a book, listen to calming music, or take a warm bath. Sleep is your friend, not your foe, when understood correctly. The link between oversleeping and stroke risk is an important reminder that our bodies are complex systems and all unusual signs need to be listened to and understood. Sleeping a lot isn't always bad, but when it becomes a prolonged pattern accompanied by fatigue and low energy, it could be a warning letter from your own body. Instead of panicking, act proactively. Reevaluate your lifestyle, seek professional medical advice, and commit to comprehensive health care. Prevention is better than cure, and early recognition of potential risks is the key to protecting your precious brain from the specter of stroke, paving the way for a healthier and fuller life. Sleep,
when regulated and placed within the broader picture of overall health, will always be your reliable companion.
In summary, sleeping too much can be an important signal your body is trying to send. Instead of excessive worry, view this as an opportunity to better understand your health. A balanced life, timely medical care, and a proactive approach to prevention will help you protect your most precious asset, your health. Let sleep truly be a time for recovery and regeneration, not a hidden concern. Taking care of your sleep properly is taking care of your future.